This is the Tom Anderson Show, broadcasting live from the KVNT studios, 7 to 9 a.m., Monday through Friday.
Chief Medical Officer for the state of Alaska, Dr. Zink, joins us. And this has been, Dr. Zink, a pretty headline-laden week or two, not just in Alaska, but across the nation, as we see either testing lines populating or we see vaccination questions arising. We see not so much public shaming, but people like me that push vaccinations and say, my wife, my parents, my family, even my 15-year-old son, my ex, Senator McGuire, everybody has had a vaccination in my sphere of influence and world. And so you have had your work cut out for you, no doubt. Are you taking a deep breath ever?
Always. I do think it's important to keep taking care of our physical, mental health as we're all going through this. No epi curve goes up forever. No pandemic goes up forever. This too will pass. It will just be how many Alaskans get sick, require hospitalization, and we lose in the process. So really looking forward to Alaskans. We're good at tough things. We're good at when the weather turns bad. We're good at helping each other. And right now we need all Alaskans to help out because we're in a tough spot with this pandemic right now. Absolutely.
When we look at headlines, I read the Anchorage Daily News and excerpts from it every morning on my show, and a lot of us look to that or Alaska's News Source or Fairbanks, Juneau, Empire. You name the region, there are papers and there are newscasts. All of them are covering to some degree or another a headline that says Alaska reports its latest COVID cases. Alaska reports right now, ADN.com, Annie Berman, today on the 17th of September, second consecutive day of over 1,000 new COVID-19 cases. What would you say that is attributed to?
Couple different things. First of all, this virus continues to change, and currently almost every case in the state of Alaska is a Delta variant. And Delta is different, and Delta is deadly. So instead of one person spreading it to 2.5 other people, with Delta, one person can spread it to 5 to 8 other people. And as a result, this surge in this pandemic is really different than what we had before. I can't imagine what this would have looked like if we had been back last fall with Delta without having the vaccines. So while we're seeing so many cases and so many hospitalizations, and our hospitals really on the brink of not being able to provide the care, and in many cases not able to provide the care that they really are hoping to be able to provide for patients, it's because of Delta, and that wave has been blunted by vaccination, but it has not been enough to really keep our healthcare capacity from being overwhelmed and so many Alaskans becoming sick. I just, when I see 1,000 cases a day, I think about that, and just that's 1,000 Alaskans. So say I have 1,000 Alaskans who tested positive one day. About 260 of those will be children. About 23 of those will end up in the hospital. And, every other day we're going to have one kid become hospitalized. And every day we're going to lose, out of that 1,000, we might lose, about 2 of those people. So when I see 1,000 cases, I think of 23 hospitalizations, and I think of 2 deaths out of that number. Granted, those aren't guaranteed, but that's looking at the average rate of hospitalizations and deaths in the state right now.
Doc, I'm going to ask you something that frustrates me, and I have to report on it every morning, and we get calls and snipes on social media, and then I read it in blog commentaries, which I know I shouldn't do for mental health. I should go hiking. But that said, what frustrates me is when someone says, hey, it's BS. And I say, what's BS? And then I think, oh, no, be prepared, maybe a ding-dong comment. And what it is they say the hospital numbers are not accurate, and they're suppressing this, or they're not showing their complete rooms, or they're not, or the chief of staff for, let's say, Providence, that they're off base when they say, hey, please wash your hands and wear a mask and be careful. And I'm thinking, what planet am I on? What would you have the chief of staff or Dr. Zink or Adam Crum or Dunleavy or Biden or whomever say, but Biden I won't throw in because he frustrates me, but locally in Alaska, what would you have them say in terms of the numbers reporting if there are so many beds that are open to use and they're full. I mean, that's not misrepresented, is it? I know you don't speak for the hospitals, but for the most part, you're a somewhat auditor as you're dealing as the chief medical officer. Have you seen any malfeasance or maybe misperception or misdirection, or is it accurate? I would assume it's accurate. The numbers we're hearing that beds are full.
The beds are full, and what you were really speaking to is this kind of tale of two worlds, and I think this is leading to a lot of, honestly, frustration and burnout within the healthcare. I worked a clinical shift last night, and probably about 3/4 of the patients I saw were there because of COVID or something COVID-related. During that time, saw very young people, healthy individuals who say they never get sick, very, very sick from COVID-19. Almost all were unvaccinated last night. And, then you leave your shift and you go to the grocery store and everyone's walking around without a mask and acts like it's no big deal, and this isn't really here. So it does feel like there's this tale of two worlds between what you're seeing in the hospitals and what you're seeing in everyday life. In general, we really try in the hospitals just to do our best. We have earthquakes and bus accidents and all sorts of horrible things that we do see on a regular basis. You try, we don't share personal information. We don't share patient information. And so we don't tell those stories. We don't tell what it oftentimes looks like. And I think that makes it hard for the public, particularly in a disease like this, where so many people are asymptomatic or mildly symptomatic. And many families did recover very well from COVID-19 with no ill side effects. But on the other hand, our hospitals are not being filled up today because of non-COVID patients. They're not being filled up because of vaccine side effects. And I think Alaskans, and I think it's very human, we tend to underestimate the risk of a disease and overestimate the risk of protection, like being able to get vaccinated. So, vaccines do have side effects. They have only been around for a year. There are things we don't know. But what we do know is that all of the data today, when you look at the risk of the virus versus the risk of the vaccine, for every age group the vaccine is approved for, which is 12 and above, it's much safer to get vaccinated than it is to get COVID. And you just see that play out in story after story in the hospital every day, where people underestimated the risk of COVID-19 to themselves, to their family, to their kiddos. We see in communities where vaccine rates are high, less kids are getting sick from COVID-19. And kids less than 12 can't protect themselves right now. And so we are really seeing an uptake in both hospitalizations as well as cases in our pediatric population. And that's a trend that's been following nationally. So, we have as parents, we take care of our kiddos. And the way that we can take care of our kids right now is to get vaccinated to minimize our chance of spreading it to them. The way teachers protect the students, and that's the way that we work together as a community. Most of our communities only have one hospital. We have really limited healthcare capacity in the state. And when we need it, we need it. It might be for your appendix, a car accident, or a stroke, but it might not be there for you now because the hospitals are so full.
Yeah, it's huge. It's huge. And hey, I have one sibling. I lost him at where you used to still work at Valley Matsu Hospital out here, and he was very ill. And if there wouldn't have been room for him, it was pre-COVID, thank God, but it would be a nightmare. And you mentioned some other maladies where people need attention, and we don't want beds filled from COVID. And Dr. Ann Zink, Chief Medical Officer for the state of Alaska, just explained the way to get around that. Now, we had questions earlier. Ernie, Dalton, some folks in the Valley. Dalton had a question about the Delta variant, and is there I know the answer, and I know what you're going to say, but I'll ask it anyway on air. Is there a vaccination for the Delta variant, or is it still the Pfizer, the dual, and then the Moderna, the dual, and the Johnson, the one, and then the maybe a booster coming? I mean, that's headline news today as well, as they decide if they're going to go forth with the booster. I can answer it, but you can maybe affirm that there isn't a separate vaccination for Delta, and there probably won't be for these variants, right? I don't think you could do it quick enough. Could you make one?
Yeah, so great question. So there is ongoing research and science on all sorts of things, including new vaccines that could be slightly different for the different variants. We're also seeing vaccine research that is happening right now that could be a shot that would include like RSV, influenza, and COVID. So, you would just get potentially one, shot in the fall, and that would contain all of them. So there's a lot of research along those. But what I would say is that the 3 vaccines that we have out now look like they continue to work very well against the Delta variant. They don't work quite as well as the wild type, but they still work remarkably well against the Delta variant. So the vaccines we have now work against the Delta and are your best protection with this surging. And so I would really encourage Alaskans not to wait for a different vaccine to come out. These vaccines, over half the world is vaccinated right now. Millions of Americans and hundreds of thousands of Alaskans have been vaccinated, and your best protection right now is getting
Absolutely. No, it really, truly is. We're going to come right back. She can stick with us briefly for one more segment here. Dr. Ann Zink, Chief Medical Officer, MD for the state of Alaska, and a practitioner. She pulled a late-nighter helping patients. She's a parent. Think about that. You got to give her props. She's not asking for it. I'll give it to her. She deserves it. Above and beyond. We'll come right back. The Tom Anderson Show.
This is the Tom Anderson Show, broadcasting live from the KVNT studios, 7 to 9 a.m., Monday through Friday.
And we are back. Thanks for that break, Dr. Ann Zink with us, MD, medical practitioner, parent, Alaskan that loves this state, wants to see people healthy and protected. She's the Chief Medical Officer, Governor Dunn. When you got that call, was it Adam Crum that called you? Was he appointed commissioner? Were you already there? Because I know you worked at the hospital out here in the Valley, and you still do. How did that transition work? Did you say, I want to keep my private practitioner gig going and I'll do your job? Or how did you balance it?
Yeah, no, great question. I actually got called by my predecessor, Dr. Jay Butler, and he had given a national job and he was moving at that time. And he had asked if I would be interested and wanted to kind of feel out if that would be of interest. And it had kind of always been a dream job for me. I never really thought it would happen, but I was like, oh, I wasn't really expecting that. And so he talked to Commissioner Crum. Commissioner Crum called me. We had a long conversation. I had agreed to a family commitment for a year, and so they called me in January, and Dr. Lily Liu was kind enough to stand in the interim for 6 months until I was able to be here. And it was actually a really great 6 months to just learn a lot, really reflect a lot, and get to know the team here better because there was a transition in public health directors. So Jay Butler was both the chief medical officer and the public health director with two deputies, and we changed it. So Heidi Hedberg was the public health director, and I was the chief medical officer with one deputy. And I think that was a great transition, but she was also moving into that job. So we both transitioned July 2 years ago now, so right before the pandemic started. And really interested in just how to make systems of care better. But I have also always known that patients are my why. I love meeting people individually, hearing their stories, and being able to have the privilege of meeting them when they're at some really challenging times. And I wasn't ready to give up clinical practice. So I said, one of my requirements of taking the job was that I would still be able to work clinical shifts on nights and weekends. And they were kind enough to agree to that.
Wow. No, I love that. I bet you're one of the few that really does both. Now, Tom just sent me Corey Allen Young. This is live, obviously. Anchorage Mayor Dave Bronson today named Joe Gerace, G-E-R-A-C-E, Grace, as the Director of Municipality of Anchorage Health Department. Has more than 38 years experience in emergency service delivery and 20 years experience working in disaster response. He was a firefighter, paramedic, Red Cross disaster responder, and medical detachment commander. So not a doctor, not a healthcare provider. That'll be interesting to see how he runs that. You'd think maybe he'd be in the fire department, not in the health department. You have to work with folks like this new fellow Joe under Mayor Bronson across the state, right? You're dealing with city and borough, all the layers of government, the directors.
Mm-hmm. Yeah, absolutely. Go ahead.
Well, I was going to say that the reason I bring that up, you're saying what's the point of that? The point is that logistically, that's not just helping patients and having policy for the state and basically promulgating it, implementing it, delivering it. But that was my point in a compliment way. You have to deal with many municipalities.
Mm-hmm. I do, and it's one of the great privileges of this job. Honestly, recently I've been almost every night spending the evening with some other city council or some other board and hearing from them and what this looks like in Valdez, and what does this look like in Bristol Bay, and what does this look like in Wasilla? What does this look like? I mean, that was just kind of this week's set of them. And it's fascinating. We live in really different parts of the state. We have different needs. We have different resources and tools to help keep each other safe. We have different priorities as communities. And our response has looked really different. But we really want to make sure every community feels Like they have the same resources that we have at the state, the same information, answers to the same questions, everything from testing to masking, and be able to partner with them on trying to figure out ways that they can help to keep their community safe and healthy and open and moving forward. And so, yeah, looking forward to working with the new director. I don't know him at all. Anchorage is large, and they have their own public health powers. So 2 regions in our state have their own public health powers, being the North Slope Borough and Anchorage. And so they really kind of run their own public health response, but we work with them very closely. And are looking forward to that.
It makes sense. Makes sense. By the way, treatment. I do want to ask you a question. We're talking with Dr. Ann Zink, Chief Medical Officer for Alaska. Treatment in the hospital. Let's say someone gets COVID, it gets worse. Maybe they have an underlying condition, which seems to be most times the case when they get worse, or their age or something to that. We've all memorized it based on PSAs and news. So now they're at the hospital and there's treatment. How do you treat them now? And has that evolved since when we first learned about COVID-19?
For sure, treatment has changed a lot. Viruses in general are hard to treat because they use your cells to replicate. So it's hard to use any sort of medicine or pill to be able to attack a virus because you'd have to attack kind of that cellular structure, and they don't have cells. They use our cells to replicate. So there are antivirals, but they don't work nearly as well as, say, like an antibiotic. So in general, we treat and we kind of prevent viruses more than we treat viruses, and that's why vaccines are really for viruses. Most of our vaccines are for viruses, so that we can teach our own healthy immune system how to take down the virus as quickly as possible. But sometimes that's not enough, or sometimes people have made a choice not to get vaccinated. And so then the next best treatment option is what we call passive immunity. And it's where you give someone antibodies to help to take down that virus. And these are in the form of what we call monoclonal antibodies. So anyone over the age of 12 who has any high-risk features, so obesity, hypertension, cardiovascular disease, pregnancy is a huge one. And if they test positive for COVID-19, they should highly consider getting monoclonal antibodies early. It does not work later. It doesn't work by the time you need to be hospitalized. And so getting them early is really important, particularly within those first 10 days. So it's another good reason to get tested and to get monoclonal antibody treatment to decrease your risk of hospitalization.
And this word ivermectin, what is ivermectin? And I asked that because someone just wrote and said, ask about that. And I keep hearing that, something about horse tranquilizer. What is that?
Yeah, so ivermectin is an FDA fully approved medication that's used primarily for parasites. It actually got the Nobel Prize in 2015, and there's a lot of studies and research behind it. It's usually used in really small doses to help to treat parasitic infections. In countries with high parasitic burden, like India, there were some initial promising studies. And initially, we saw some promising studies in looking in cell culture that it might help to prevent the virus from entering the cell. Unfortunately, what we're seeing in real life is that we aren't seeing any additional benefit. And what we are seeing is a lot of people trying to get ivermectin either from their provider or from veterinary supplies, such as horses, and taking really high and potentially toxic doses overall. So I wish that the data looks like ivermectin works better, but when you really break down where it's used and how it's used, and for example, the IDSA, the major association for infectious diseases here in the U.S., really does not recommend it. And even Merck, the only company in the U.S. that makes ivermectin and would be the one company to benefit from the profit of the cell, says that there's no benefit in using this drug at this time for COVID-19. Wow. It should not be used for that. So.
And one other quick question, Dr. Zink. Ernie had asked Matsu about the idea that you take the vaccine and you don't feel well from it. Is that happening more than not? Because, some are saying, whoa, there's all these manifestations from it. In my circle of people, nobody's had any problem. Nobody. I can name 20 people that have had the vaccination in my family, not zero problems. Is that something you're taking into consideration, or is it just a aspect of it? It's better to err on getting the vaccination.
We always want to look at that, right? We don't want to cause harm. Do no harm is always that oath that we go back to. And if you look across the population, people will get a sore arm, they can develop a fever, they can develop chills, but there are some other more serious side effects from vaccination. So about 2 in a million people can develop an anaphylactic reaction where they can get hives and shortness of breath, and they can be treated with epinephrine. And that's why we watch people for 10 to 15 minutes. And then there are some other rare side effects, including myocarditis of inflammation of the heart or blood clots, particularly in middle-aged women. But when you look at the risk of everything from myocarditis to blood clots in the same group, in the same age group, so again, take young men who are the highest risk for myocarditis, they are much higher risk of getting myocarditis from COVID than they are the vaccine. Same with blood clots in women. Much higher risk of getting blood clots from COVID than you are from the vaccine. So there are risks. It's just substantially less than the risk associated with COVID.
Than getting COVID itself.
Than getting COVID itself. That's the thing. I mean, I wish we didn't have either, right? If we didn't have COVID, we didn't need the vaccine, because everything we do has some risk. But
no, this is true. Well, I agree with you, and I agree with your the mindset that it's better to err on getting it based on all the data you just expounded on. Okay, you can check her out online. You can go to the Department of Health and Social Services. You can get their updates. Chief Medical Officer, the Commissioner, the Governor, they're letting people know every day what's going on with numbers. So, Dr. Ann Zink, keep up the good work. We're very proud of you, and we look forward to getting another update before the end of the year.
Thanks, Tom. I really appreciate the time.
Absolutely. Bless you. Yeah, thank you. Take care, Alaska. Like she said, she's the top doc for Alaska. Folks, enjoy your weekend. Drive safe. God bless. Tom Anderson Show.